Hola, hola, amigas. Welcome to another episode of Modern Latina in Midlife. I am very excited to bring on today's guest. We talk about all kinds of stuff affecting us women over 40. We talked about our physical changes, hormonal changes, changes in our mental health. FYI, we don't all hit depression. So she made some really great points and some pointed out some risk factors that we can take into consideration to get an idea of whether we're going to hit a depression state in our midlife. Anyways, we talked about sexual changes, things that are happening in our body, sex wise, way down there, what's happening to our libido. And we talk about muscle atrophy. We talk about aging and pro aging, or, you know, um, the things that we choose to do to try to keep ourselves feeling and looking young. And we just really get into some really, really great topics and conversations. And I know you're going to enjoy this. And there are several aha moments. I know for me that there were several mind blown moments of things I hadn't even thought about, because I haven't gone through them or they just hadn't reached my level of awareness. So definitely a really great one to listen to. But my guest today is Dr. Isette Aragon, known as Dr. A by her clients and peers. She is a licensed psychotherapist in California, Colorado, and Texas who specializes in complex trauma. She is trained in cognitive behavioral therapy and in EMDR. Her patients appreciate her direct, no nonsense, and loving approach to therapy. And I think that you're going to hear that in this conversation. So, without further ado, let's welcome Dr. A. Welcome to the podcast, you said. I appreciate you being here to discuss this topic that I think it's probably very near and dear to both our hearts because um, as women over 40, we just briefly started discussing, we start being ignored in the medical and the mental health field. And, so tell us about it.
I mean, it's so crazy because sometimes I feel like we're treated like spoiled milk, like we have some sort of expiration date. When you think about the pressures that women face already at 34, we're told that we are, AMA. And for those that don't know what AMA stands for, advanced maternal age. So we're already having this pressure, which, by the way, women are having healthy children later on in life because of
Correct.
a whole bunch of medical advancements. So we're doing well in that area, but there's this pressure, to have babies by a certain age. And if you really think about it, there are women who are roughly 35, 36, 37 who are already reaching that perimenopause state as well. So here you are being told, hurry up and have babies because you're already going to reach this other stage where you may not be ovulating and just biologically things are starting to change in your body. But yet no one talks about this other stage. It's like
Correct.
embarrassing. And so clients will often come to me and say, I don't know what's wrong. I'm starting to feel different. My libido sucks. I don't want to be touched, and a whole bunch of other things. And it's like,
Mhm.
did it ever occur to you that maybe the beginning of menopause is starting to occur? And have you spoken to your primary care physician about it? And oftentimes I hear, no. Should I
Correct.
should I
Mm.
talk to them?
Yeah.
Yeah.
Yeah, isn't that weird? We have to be the ones to talk about it and bring it up. That's kind of why I started this podcast, because it was like, what is happening? What is going on? And mind you, I didn't start perimenopause until almost 50, but still, it's like, mom, like, I don't know what's happening. Like, she's like, I don't know. Yo no sé. Nothing happened. I'm
Right.
like, what do you mean nothing happened? Like, what? It's like, okay, so we're just sweeping this under the rug too. I'm like, no, 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 no. You know?
No, we definitely have to talk about it. I mean, in the US, unless the stats have changed, but I checked them recently, and most women are going through full menopause by the age of 52, 51, 52.
Mhm.
So yeah, and that doesn't mean that life ends at 51 or 52. Like people, like newsflash, cover your ears. I know you have kids. Like mom is still having sex, like we have to talk about these things. We don't just die off. There's still value in all of us, but nobody talks about it. We do change
Right.
again biologically. Like there are clients that will come to me and they're embarrassed to say, like, I feel like I'm changing down there. Yeah, you are. Certain things start to atrophy and no one wants to talk about it. There is vaginal dryness. Yes, you can say that out loud and no one wants to talk about how to deal with those things. And
Isn't
for
that
the
weird?
yeah,
Yeah,
it's the
it
most
doesn't even
part.
hardly enter the conversations with girlfriends. Until, like, I start prying a little bit more and saying, "Oh, I'm gonna have a sex therapist on the podcast. What do you guys wanna ask? What do you guys wanna know about?" And then they're like, "Oh, you know what? There's this thing." I was like, "Oh my gosh, and why aren't we talking about this?"
Right,
Like, we shouldn't be embarrassed. Like, if this is normal, number 1, we should know that this is gonna happen. Much like puberty. We know we're gonna get our periods. We know we're gonna break out. We expect it, but
right.
yet we don't expect that these changes are going to happen in at this stage of life, and it's all hormone related, so why not?
Well, and we also don't bring it up to our partners. And I think that that's so silly because when I do ask my patients, have you spoken to your partner about it? No, that's too personal. Huh? Hold on a second. He's in your stuff, really in there, right?
Seriously. Like, he knows.
He knows. He can tell that
FYI.
something has changed. You've had a baby or not, but the point is like he can tell that there is a difference, and he may not want to bring it up. So,
Yeah, he's
so
waiting for
help a
you to bring it up.
help a brother out and get some lube in there because this isn't working and it's painful.
Seriously.
Yeah, no, I agree. I
Oh my
100%
gosh, that's
agree.
funny. Okay, so how do you, in your experience, how does ageism and gender bias within the healthcare system contribute to inadequate medical treatment of women in midlife, whether it's, like physical health or even mental health?
I don't think, and I say this with a lot of respect toward my peers in the medical field, and I come from a place where I spent the majority of my career in an acute care setting, so in a hospital setting, and then in primary care as well. Not many are trained to address this or actually a lot of other issues. And so I think that in general, when a female goes to see a male primary care physician, they don't often get the appropriate treatment when it comes to certain subjects, especially the one that we're talking about now, because it could be a cultural thing that doctor may not feel comfortable, obviously, having a conversation with their female patient about menopause, what's currently happening in the body. They'll talk about the hormonal stuff and they'll talk about maybe hormone replacement therapy and things like that. Or they may just wipe their hands of the
Mm,
patient and
mm,
say, I'll refer you to gynecology and then you'll be on your merry way. And they'll deal with it that way. But oftentimes they won't ask, how's your intimate life? Are any changes going on that you noticed? That hair on your chin, is that new? No one talks about these things. And so oftentimes they go ignored.
mhm. Yeah, that's interesting that you say that because, yeah, we start noticing changes. Like I haven't noticed the hair on the chin, but I've heard of people talk about it. But I've noticed other changes, and I'm like, oh shoot, I'm not going to say anything about it. Maybe nobody will notice.
Right.
If I don't say nothing, something's happening, and it's weird. And I never stop to think that this is the normal part, and that probably everybody's going through the same stuff.
Right.
You know, so.
Or I think that they don't maybe know enough that let's say someone is entering menopause and they're coming in with symptoms that mimic a panic attack. And it's like, wait a minute, it's not a panic attack, it's a hot flash.
Mm.
And so then certain things get misdiagnosed. And so then
Mhm.
they get referred to therapy, right? To psychotherapy, behavioral health, which is fine. Hopefully we'll figure it out when you get to us. But oftentimes even that is missed, right? The subtle differences between I am having a hot flash and is it really a hot flash or is it a panic attack? How am I able to
Mm,
decipher between, one and the other? Well, usually when you're having a hot flash, you also don't have major palpitations, right? So that's one telltale sign where, okay, how do I know the difference? Usually in a hot flash, your heart is also not feeling like it's going to beat out of your chest. Your heart doesn't feel like it's coming up through your throat. And that's what I always tell patients, right? So you're
okay.
going to feel hot and
Uh-huh.
you're gonna feel like you wanna rip off your clothes and stick your head in the, freezer,
Mhm.
but you're not gonna feel like you're necessarily dying. The panic
Mhm.
attack makes you feel like you're having a heart attack,
Okay. Okay, thank you for pointing out that difference, because some of us might not even know for sure, you right?
right?
Like, sometimes I'm like, "I think this might be a hot flash, but I don't know. What is it? Like, I'm hot, I'm cold." I mean, I'm sitting here like I'm in, you know, living in the snow, but in a few minutes, this comes
Well, I'm
off.
like
It's
that too,
just
and then I get hot, so because
yeah,
my
it's
ring light is on, so
like this constant, I don't know how to dress for anything
in
anymore.
layers, we dress in layers
Yes, it's
when we
like
hit 40, that's what we do.
exactly. Um, okay, so thank you for bringing that up and the lack of training, which is nuts because it's such a normal part of what we're going to go through. All women are going to go through this. Why? I just don't understand why there isn't more attention placed on that.
Well, but it's funny, let's bring up an unrelated subject. Death and dying is a normal part of life, yet plenty of doctors aren't able to really manage that subject either. They didn't go to school to deal with death and dying. They're in the business of life, not death and dying. So,
Mhm.
unless you're a palliative care physician or an end of life physician and you're dealing with hospice type patients, they're very uncomfortable having that conversation as well. And when they lose a patient, they have failed, if you think about it,
Mhm. Mhm.
right?
Right,
And
right,
so,
right.
this is kind of to me in parallel with that. It's just not
Mm.
something that we talk about. We're not gonna do it. It doesn't exist. We'll get there, but it doesn't really exist when it does.
Mm, geez, okay. Wow. So much to think about there.
I know.
So, in terms of mental health, what
Mhm.
are some unique challenges then that you're seeing in women over 40 based on what you see in your practice? What are is there like a common theme or like the top 3 most biggest challenges that women are facing or what are you seeing?
Let's talk about the myth first. Just because you hit menopause does not mean that you will be depressed, anxious, or enter a space of psychosis. I'm gonna repeat myself. People need to hear that. Just because you have hormonal changes does not mean that you will become depressed, anxious, or enter a space of psychosis. What matters here is what happened before. So, if you've had children and you had postpartum depression, if you are someone who's already suffered through depression and or anxiety or had a psychotic break, then yes, you are absolutely more likely entering menopause to have depression, to have anxiety, and to possibly have a psychotic break. But if
Wow.
those were things that did not exist prior to, then not something that you should be super worried about. Same thing when it comes to intimacy, when it comes to sex. If you had a pretty damn good sex drive prior to entering menopause, chances are you're going to stay in the same space, right? You're still going to have a good sex life. Yes, you may have to use some lube. You may have to go on hormone replacement therapy because it makes you feel better. Okay, fine, but your sex life isn't necessarily going to suffer. You may not get turned on the same way, and I'll talk
Mhm.
about that a little bit later, but it won't necessarily suffer. If you are someone, though, that has previous sexual trauma, like sexual assault, rape, or already had some sort of other issue, hang up with intimacy, you and your partner were already struggling, then yes, you will probably absolutely suffer when you enter menopause. That should not be surprising. The same
Wow.
way that if, for example, you have a baby and you're like shocked, why am I suffering from postpartum? Well, if once upon a time you were already depressed prior to, again,
Mhm.
it follows very much in the same way.
Oh, wow. That's really interesting. I work with a maternal mental health specialist, and that's one of the things that she talks about, those precursors
Mhm.
to postpartum. So it's interesting now to see like how this is really just going to continue being a connection point throughout life. So wow, thanks for bringing that up. That's good to know. We should know that. We
We
should
should know
absolutely
that
know that.
because you know what, the body and there's a great book, a trauma book actually. It's called The Body Keeps the Score. But
I
the
need to
body
read
does,
that.
right?
Mhm.
And so the thing about it is again, if you've had things that have occurred in your life that have negatively impacted your life, even if you have worked on them, they may pop up again in this stage of your life. Hormones are changing.
Mhm.
Not
Yeah.
uncommon.
Yeah, 100%. I need to read that book because even though I haven't read it, I always talk about how the body keeps the score on an energy level because I do energy work and I feel like those emotions, I always see them pop up, repressed emotions or things that we thought we already worked through. They keep popping up and we have to kind of keep doing work on that. So I definitely need to read that book because I'm constantly saying the body keeps the score. Like it hurts there because there's something stuck still from, emotionally. So,
That's a lot of the I mean, that's a huge part of why people don't really heal, and that is because things are still living within us that
mhm.
we either refuse to bring to the surface, we're in denial over, or quite frankly, we forgot that it was there.
Right. Right. Yeah. 100%.
Yeah, there's a lot there.
Yeah, there's a lot to unpack there. Um so in your experience then, what are some misconceptions that medical professionals often have about like women over 40 that are affecting us?
I think the misconception is that we don't want to talk about certain things, that we don't want certain interventions. Let me give an example. It's been in the works for probably at this point a little under 10 years. There has been, they call it the pink pill. It's not always pink, by the way, kind of like they used to call Viagra the blue pill. I don't know if you've heard of the medication called Addie. You heard of Addie? So Addie is like, I don't want to just say it's the equivalent to Viagra, but it's being used for women right before they hit menopause or around menopause to help increase with low libido. And it got some attention. And you saw a couple of advertisements here and there, probably sometime this year, maybe last year. But I believe they started working on this medication sometime in 2015. And what's funny is it doesn't get brought up a lot by physicians, by primary care doctors, and I'm thinking, "Why? We wanna talk about these things. We just don't know that it even exists." So when I bring it up to my patients and I say, "Hey, let's see, I know that it's marketed for this, but my God, we use medications for off-label use and secondary things all of the time. See if you're a candidate and if it's appropriate for you to be prescribed this med." And oftentimes the doctor will say, "Well, sure, why not? Let's try it." But had I not provided that level of education to my client, that doctor would have never said anything. So I think the misconception is more of we're just going to deal with our symptoms in silence, suffer in silence, maybe not say anything, and just, or the cultural thing. We're
Mhm,
Hispanic, Latinos, we don't want to talk about it. It's
mhm,
taboo. We'll just kind of deal with it with,
mhm.
I don't know, home remedies. What do they want us to do? Like grab Vicks Vapor Rub and stick it down for
I
the
know.
best? Like, I don't
Windex
know.
Windex and vapor rub. It
Right,
should solve
right.
all your problems.
Exactly. Put some tussin on it. Like, I don't know. You're right. Yeah.
Yeah. Okay. Yeah,
And I
yeah.
and the other misconception, which I debunked earlier, is that somehow we reach menopause and that we're all hysterical, depressed, and anxious. No, if we've not had
Mhm,
a history of any of that, we are none of those things.
mhm. Correct. Um, I've had a very, very short bout with depression after my divorce. I don't feel in any way depressed. I just don't see that that's going to happen. I seem to be always very like on the up and up. Um, so I don't see that happen. I definitely have seen that experience with some of my friends. Um, what I'm getting at is I feel like this is the best time of my life. I'm like 51, almost 52, and I just feel like, oh my gosh, this is amazing. Yes, I've got stuff going on, all of the stuff we've talked about, the wrinkles. Of course, my body's changing. So there's an adjustment there as well. When I look in the mirror, it's like, oh, like I have to get to know this new woman now, and just grow into that. Like I'm not opposed to aging. Um, but it's also like all of a sudden it hit me, It's like I've always felt like I was way younger than my true age. So now it's like, okay, I'm gonna embrace this. Just give me a little bit of time to get used to looking at myself this way, and and just
You
get used to that.
remember being 21 and thinking that
Yeah,
40 was old?
gosh, right? I remember looking at my mom at my age. She was already a grandma several times over. And I'm like, and not that there's anything wrong with being a grandparent at this age, but my mom looked very different and acted very different at my age. So it's a new era. It's a new time. I feel like we're reinventing what midlife looks like. And I feel like at this age, there's so many years ahead of us. Like, why settle? Why just be okay with it feels dry down there and it hurts, so I'm just gonna leave it alone?
Or
Like,
I'm not gonna date. I'm not gonna go on
right.
a dating website. I'm not gonna have sex. I got divorced at 44 and it's over for me. I have my kids. They're great. That whole speech, I hate that speech.
Yeah.
Right?
Like,
Like
what for
my life is
anymore?
over. It's
Like,
okay.
yes. Yeah, it's like, "Oh, I really wanted to do this." I'm like, "Then do it."
Right.
Like, "Oh, this is what I really wanted to do, when I grew up, but I didn't do it, so now it's late." Are you kidding me? Are you gonna live the next 30, 40, 50 years like, I didn't do what I wanted to do? Like, why not just change that? It'll take you maybe 3, 4 years if you wanted to go back to school. I don't know, I just think that that's why I'm doing this, and that's why I'm bringing people on like you to, like, talk about these things and bring light to them and have these conversations so that we can stop saying, "I didn't know that," or so that we can start opening up these conversations with our providers as well. So, I appreciate you, bringing light to that.
I mean,
I did
lifespan for, in the US, Americans, 78 years. Okay, so think about where you're at. And I tell my
exactly.
clients this, you are roughly, let's say 40, whatever the case may be. Do you really want to live? I mean, my God, we're almost at 80, right? Like 40 more years of your life this way.
Right. The
Think of
second
the
the
magnitude
second
of
half
that,
of your life.
right?
The second half of your life, really, you know? Like,
Time's going to
no.
pass. How do you want to pass the time?
Exactly.
What do you want to do with it?
Exactly. That's a very good point. I love that quote. Time's gonna pass. Anyways, so
Right.
why not just make the best of it and have fun?
I agree.
Um, so going back to, you brought up a point about sex and getting turned on. I like the topic. Tell me more.
Getting turned on. What can I say about this psychologically? Sometimes when you enter the space of perimenopause or menopause, you do not get turned on psychologically in the same way. It doesn't just automatically happen. And so, what we encourage patients to do is actually plan for sex, plan for intimacy, have that kind of a night, a time frame, and make it fun. And it is then through the making it fun, having it planned, and connection that you actually start to become aroused. So that is what I was getting at as far as don't think that it's just going to come, haha. I know, funny joke. Sorry, I had
No
to.
pun intended.
I know, right? I think that sometimes I'm like a 16-year-old child. And so Dr. A is so appropriate sometimes,
I love
right?
it.
You have to laugh about these kinds of things. But It's just because something takes a little bit more effort or planning, it doesn't mean that there's something wrong with you or that there's something wrong in your partnership or your marriage. Life has changed, hormones have changed, things are just different. Also, do not be afraid to try different things, whether they are toys. Some people call them, I love this term, sexual assistive devices because they don't want to call them toys. I respect that. Okay, fine. And I'm serious, right? Some people
I
like to
feel it's
call
more medical and
it does too.
geriatric
I'm like,
to
but
call it I'm just call it a toy,
it's
it's so much
right.
funner.
I think it's way more fun to just say toy, but some people wanna call it a device. I'm like, "Okay, well, whatever
Well
literally floats your boat, girl, that's fine." And then the other thing too that we don't talk about, you can actually ask your physical therapist like, "Hey, I'm also having issues with other things happening to me as far as urinary incontinence and other things sexually. What should I be doing?" They will help with, suggesting certain exercises, which I don't really speak on because it's beyond my scope of practice, but
Mhm.
they'll come up with some kind of program, so that you're able to do this stuff at home to strengthen muscles so that you do have not only better sex, but that you actually don't pee on yourself. I mean, novel idea. It's rehab. It's rehab for your vagina, like, we
I'm
don't
mind
like to pee
blown.
ourselves.
I'm mind blown.
Yeah,
Um,
and
I
by the
know
way,
that I
Kegels, right? We talk about Kegels.
yes.
For the men, if you ever listen to this podcast, you guys can do Kegels too.
What does that do for them? I know
Well,
what it does for that for us, but, like, what are they supposed to do? Like, tighten the
I think it also does some strengthening work for them as far as, lasting and different things, so it's
hmm,
also a healthy thing. And speaking on the PT part, have you ever been to physical therapy
I
before?
have not.
You've not, okay. Have you ever, well, maybe you've seen it though, at least at the gym, there's a thing that looks like a wedge, like a triangle, and
Mhm.
oftentimes they use it for different things for to support the back during a sit-up or in any case. You guys, you can actually use things that you would normally use in PT in physical therapy during sex.
Interesting. Yeah,
100%. If
like
you need
the
your back supported, you can use a physical therapy tool during sex, and you should not shy away from that.
oh my gosh.
Individuals who have a limitation, there should not be a limitation. The same way that
Yeah,
we can use a wheelchair, the same way that we use a ramp, the same way that we use a cane. No,
yeah. Interesting. I guess I had never given that any thought, probably because 'cause I'm not there
because you
yet,
don't have a
thank
bad
goodness.
knee or you don't have a
Because
bad
'cause I'm
back.
not there yet, but it's
But
good
if
to
you ever
know.
were to be there, then you know that you
Then
can
I
do
know
these things.
that Imma go get a wedge.
You're gonna go get a wedge and you're gonna wedge yourself and have a great time. It's true.
Oh, is it? It is true. I mean, why are we gonna suffer here and just give up on fun stuff, you know? I mean, I feel like this is the age when we can really truly start to have fun because we're no longer having to take care of the kids. We have the ability to get more sleep and do more fun things and we have the mental space for it. So like why just give up on life? That's why I think that this stage of life is so powerful and so fun. You know, it's
I
like
would like to believe that we've also reached, I would like to believe, not all of us, but and that's why there's therapy, a space of being healed. And so with that space, sometimes comes finally the attitude of I can finally live because there are certain small things that I no longer give a shit about that interrupt my life.
mhm,
And that makes me so much more fulfilled, complete, happy, you
mm,
fill in the blank with the adjective,
mhm,
but it's helpful. Some
yeah.
of our previous traumas are our biggest awakenings,
Mhm.
and that's incredibly, I think, powerful.
I think so too.
It's
I
liberating.
it is liberating. I love discovering like, "Oh, I need to work on this," because, you know, whether it's a trigger or something that pops up, it's like, "Oh, okay." Because when I work on it and get to the other side, it's always a much more wiser, elevated. I feel more elevated, just wiser, just a better version of me. So when those things happen, it's like, "Okay, here goes the work," because it's work, but then coming out at the other end It's like, "Oh, wow, that was beautiful." And then I can share that, you know? It's like I can share it with others and maybe hopefully inspire or, help them go through their stuff as well, so
But do you find for you that there's also less shame that has come with age? Because I know for me, the older that I get, I mean, I was always pretty damn transparent. I think that's my superpower. You know who Brene Brown is, right?
absolutely,
Okay.
yes.
Well, and one of her superpowers is, and she has openly said it, her level of comfort with herself, her vulnerability sometimes makes other people uncomfortable. I am
Mhm,
the same way. I don't have look,
mhm,
you guys, if you ever see me at a restaurant and I'm crying, I have no shame. I could be at a
mhm,
bar crying, I have no shame. I love
yeah,
emotions, but I also am aware that it makes other people very uncomfortable.
mhm, yeah,
Right. And so, I shared in one of the last podcasts that I did, personally, my dad unexpectedly died last year. And what he did for me is this. I already had a short fuse to begin with. I'm just built that way as a person. Now I have no fuse left, which sometimes I have to watch. But what I mean by that is I don't put up with any bullshit at all. And that is pretty damn liberating because it
mhm,
allows me not to waste any time. Life
mhm,
is really, really short. So to waste it
absolutely,
on anything that isn't worth it, don't waste your time having bad sex, being dry. Don't waste your time being depressed when there are therapists and medications that can help you. And by the way, speaking of medications, I'm not a med pusher, but if you've been in therapy with your therapist and you've really been putting in the work and you've done some complementary and alternative medicine work like what you spoke about earlier, and that is, work with Reiki or around energy or anything else, but you see that still there's a level of suffering for you, then that's the time where you can say, maybe I should explore meds.
mhm,
And just because you're on medication for some time doesn't mean you have to be on medication forever. Sometimes it just
100%,
takes you over the hump. The
100%.
industry standard, we like to see people on meds for about 6 months because we hope that in that 6 month period, you will gain the necessary coping mechanisms, right? To be able to come off meds and then go live your happy life.
100%. Thank you so much for bringing that. That has been my personal experience with myself and a really close loved one as well. That the meds were just enough to like get me to my baseline and then be able to see clearly, you know, and like open my eyes and go, oh, okay, I got it, and kind of feel like I'm back at it and I can now really truly start working on what's underneath it and then be able to get off the meds and then be like, "Okay, like I
But I
got
love
this."
that you said that because it's the weirdest thing. All of you say the same thing. My patients say the same thing, and that is I was foggy and cloudy, and I don't even know how else to explain it, but that's the state that I was in. And now I'm much more clear-headed and I'm able to make decisions because before I was afraid to make decisions in my depressed state. And on top of that, I now have the energy to do certain things because here you are, Dr. A, encouraging me to do all of the things, the affirmations, the movement, the having a good sleep hygiene routine, your morning routine, the avoiding social media first thing in the morning. And I can't do any of that when I have no energy. And
Exactly.
part of what an antidepressant helped to do was to at least get me over that space of I feel like I'm dying, I have no energy, I can't get out of bed.
Yeah.
So
Yeah.
sometimes it just takes that little bit to get you to
Mhm.
the next place where you need to be, and as you start to incorporate all of these new healthy habits, yeah, you do get to the other side.
Mhm. And you made a very you used the keyword there is habit. Like
Yeah.
once you learn these coping mechanisms, then you can start incorporating them and they become habits. So when you get off the meds, it's already a habit. You
Yep.
know, "Okay, I gotta do this," and then it keeps you at your baseline, you know? So, yeah, I love that. Okay, let's talk about, what it looks like to age and some of the taboo things around aging, whether it's plastic surgery or what have you, fillers or whatever. Can you talk about your point of view or what you're seeing?
Well, I'll say this. I think social media has hurt aging tremendously. And what I mean by that is there are so many influencers, there are so many celebrities that have aged, and they are not truthful with what they're doing. All we're asking for is honesty. I understand that people have a right to privacy, but at the same time, you've already put yourself out there and your ass is in our face anyway. So you might as well tell us what you've done to your ass. So the
Mhm,
way that I look at healthy aging is so long as you are doing things for the right reason and it hasn't gone to a space that is excessive and it hasn't become an obsession and it hasn't financially hurt your family and it hasn't become an addiction or something toxic, go for it. So whether
mhm,
that means filler for you, Botox, if it doesn't mean any of those things and you want to just age naturally, go for it. If it means that you finally want to address something because financially you're in the space to do it. Before in your 20s, you didn't have that kind of income. Maybe now you do. And it's like, okay, well, I've never had breasts, and that is a humongous insecurity for me. And now I want implants. Well, then go for it. If you're at the health status to do so, and you can afford going under the knife, not just from a financial standpoint, but a health standpoint, where it's not going to jeopardize you in any way. You can be intubated, etc. You don't have problems with anesthesia. You're making a wise choice. Phenomenal. Then I say go for it. But if you're in a
mhm,
space where it's like you are incredibly overweight, you've got diabetes, you've got other comorbid conditions that we are concerned about, and you're still thinking about going under the knife, that is where I'm saying pause. That is where I'm saying that trying to age right, I'm using air quotes, gracefully is not smart.
mhm. I agree 100%. I know that there's a big um pro-aging movement and I follow a lot of women and I love that and I respect that. But like I mentioned earlier, the let me get used to the way I'm looking, that's exactly what I mean. Like in the meantime, sometimes I'm going to go get a little Botox. Sometimes I'm going to go get a little filler because I want to. It's not to please anybody else. In fact, nobody even notices it. I do. I want to do it for me. And so that's what I mean, and I think I'm finally reaching a point in my life, and I will be honest and just speak it out loud, where I'm gonna be finally okay with I've gained the weight, I gained 10 to 15 pounds. They're not coming off. I'm gonna stop trying and just embrace it, buy the bigger clothes, and just love it and just be
You just
comfortable.
you reminded me of, oh my god, that damn movie with Julia Roberts where she said, what did she say? "Buy the fat lady pants? Eat, pray, love."
Yes,
Where she
yes,
was, like, eating the pizza and yeah.
yes. Yes, that's it. I'm gonna clean out my closet as soon as I get back from vacation because I just ordered the bigger bathing suits, one piece. They're arriving tomorrow. I'm like, you know what? It is what it is. Bikinis be gone. Like it just is what it is. I'm so
But
much
even if
more
you
comfortable.
I mean, even if you wanted to wear the two-piece,
Right.
it's up to what makes you feel
Ex-
comfortable, and that's one
exactly.
thing that, funny enough, we didn't touch upon, but obviously with hormonal change comes the unfortunate part of weight gain, right?
Hmm.
Usually anywhere between 10 to 15 pounds, and for women, we especially see the change in the midsection. The
Yes.
midsection tends to get thicker, and so, it's like, "Oh, well, I did or I didn't have this before. Where did this come from?" And it can be very, very difficult even with proper nutrition and movement to get that weight off. It's hard. And lately we have seen this huge trend, which I'm not against, by the way. We've seen the individuals using GLP-1
Ozempic.
medications, right? So we see the
Hmm.
Ozempic, the Wegovys, the Trulicities, the Manjaros. We
Hmm.
also see medications that traditionally were used for other purposes, psychotropic or psychiatric purposes. Wellbutrin And other medications that we've seen that treat usually opioid cravings. Now we're using them to treat food cravings. Same medication, by the way.
Mhm.
Again, those are more of
Yeah.
off-label type uses. There, we've seen it all. And again, when used responsibly, but there are side effects to these things.
Yeah.
So whenever you do something, you have to ask yourself, what am I going to see long term?
Exactly.
What do we know about these medications, right? If you decide I am in that 50, 51, 52-year old kind of space, and I want to lose those 10 pounds and I can be prescribed this. What are the side effects? Well, let's talk about it for a second.
Mhm.
These medications tend to contribute to muscle atrophy, which is already a problem for us. So if you are going to use these medications, just know that you still have to get in a proper amount of protein, right? You have to be really careful with nutrition because you're not going to want to eat. And then there has to be strength training
Yep.
in your program
Mhm.
because we're already prone to, right, muscle loss. And then
Right.
what will that turn into? That will turn into something very dangerous because that will put us at risk for then falling. We don't want that.
I'm glad you brought that up, because I did ask my doctor about, the semaglutide, and he's like, "Yeah, it's effective. It'll work."
Sure.
I'm like, "So what are the side effects?" "Nothing. There's no side effects." And I'm like, "I don't believe it." I don't believe that there is not one side effect. And that's what concerns me the most is the long-term stuff. Maybe not immediately, maybe not while I'm on it, but what's gonna happen long term. So then I started reading more. I'm like, "Okay, let me hold off." I started reading and, I came across what you just mentioned, the muscle atrophy, and I'm like,
The loss.
"Well, if I just strength train, does that take care of it?" Rather than having to get on it and then strength train for the side effect. Like, I don't know. It's just, I'm not against it at all either. Clearly, I asked my doctor about it. So I'm not against it at all. I would 100% do it. I'll try anything, that makes me feel good for me, not for anybody else, as long as
And
I'm healthy and all the things you mentioned.
And as long as you know what you're getting yourself into, read, do the research, ask, don't just, there's a lot of white coat respect. And I think that also
Hmm.
is a cultural thing. We see a doctor, they say a certain thing, and we take it as if it were Bible. No, if
Hmm.
you're not confident in what your doctor is saying, get a brand new doctor. I actually tell my clients, if I don't do it for you, fire me.
Yeah, seriously.
You should not be dreading coming to see me. "Oh, shit, I gotta go see Doctor A. I don't wanna go see her. I don't wanna talk about my feelings." No, you
Mhm,
should not feel that way about your any one of your specialists. If
mhm,
they're not doing it for you, they're not the fit, then find somebody else. If you
mhm,
feel like they are not staying current, go find someone else.
mhm,
It's funny, we all have to technically stay current, right? Because we have to do our complete our continuing education, etc. You guys, continuing education, I'm going to be very transparent, depending on how you do it, can be a joke. You go online, you go on a
mhm.
webinar, you fill
Oh,
out a
yeah.
certificate and you call it a day. But for those of us that really take it seriously, you can tell because we're able to talk about things. You know how a doctor is dangerous when they talk in absolutes. You'll never hear me talk in absolutes. You've heard me talk, and
Yeah,
I'll say, okay, for every one great thing this one med does, it also does this.
right.
But when you hear a doctor say, this is a holy grail, and this is the best medication, and this is the only way to go, run,
Yeah.
run, because that's how you know you've got it wrong, right?
Mhm.
Science is changing all the time. Meds are changing all the time. Treatment is changing all the time.
Yeah,
Make
100%.
sure that you are talking to someone, and even now I'm kind of going off on a tangent, but when you think about picking your therapist, ask them, how long have you been in practice and who are you seeing? Your practice is mostly made up of whom? Adults, children,
Yeah.
individuals who are depressed. What kind of trauma are you treating? You're saying that you're a trauma specialist. Okay, well, who are you really treating though? What
Mhm.
kind of trauma? Is it all sexual assault? Is it combat trauma? Is it PTSD related to fill in the blank? I don't know. What was the last book that you actually read? You're allowed to ask us questions, and you're even allowed to ask us personal questions. And, there are some therapists that have been trained to never answer a personal question. For
Mhm,
me, it's like this. If it's going to help you in treatment and it's an appropriate use of self-disclosure, I will answer it.
mhm. Thank you for bringing that in. I think that is so important, and I'm glad you brought that in. I think it's important to find somebody that you can relate to. So sometimes finding somebody who has the same kind of background, a Latina, like from immigrant parents, cuts down on the amount of time that you have to educate your therapist on your culture and your upbringing, and then they have that understanding of this is where I'm coming from. Or let's say people in the LGBTQ community, having somebody that already specializes in that, understands already in more detail all the challenges that somebody in that community is dealing with. So thank you for bringing that in. Is there more that you can more advice that you can offer around this?
There is, and I will say this. Sometimes you will run into someone, you'll run into a therapist that you say, I'm not sure about this. Still try and give them a chance because, to your point, I'm not part of the LGBTQ plus community. However, I am an ally. I have been very vocal about the fact, and I am not ashamed. I actually am more conservative and traditional, but I am still an ally. I am proud of where I come from. I am first generation here, Cuban parents, both sides. And so, with all of that comes a huge history of politically standing in a certain way. People will not always understand that. But I'll say this in brief. When your parents come from a communist space and they see programs that look too socialist programs to us are one step away from communism. So we tend to politically sit on a certain side. I'll leave it at that. That doesn't mean that I can't help you. That doesn't mean I'm not an ally. And so that's what I mean by sometimes I will still be your fit, even though you think I may not be. Because this is what I do say when they say, well, you're straight and you're more conservative. How in the hell can you help me? And my response is actually always the same. If you're asking me if I understand human suffering, what it's like to be on the floor crying hysterically like Kim Kardashian, and what it's like to have those deep emotions where you feel like you're not going to make it to the next day. If that's what you're asking me, the answer is I've been through all of those things, and the answer is yes.
Yeah.
And so
Thank you.
sometimes that's all that patients need to know. They just want to know, can you connect with me? I
Yeah.
don't have to be gay to
Mhm.
connect with
Absolutely.
you. We're connected through the commonality that is human suffering, period. I know what it's like not to be accepted. I know what it's like to be looked at differently. I know what it's like to be looked at like I've gone rogue or the rebel. I've never fucking fit in. You can tell.
Thank
So
you.
I get it. Yeah.
Yeah. Thanks for bringing that in. I appreciate it. Thank you so much, Iset. I want to be mindful of your time. Is
Yeah,
there
you're
something
welcome.
else you'd like to share with the audience? Any final pieces of advice you want for the listeners?
No final pieces of advice, but actually a big kudos and thank you to you. For those that don't know, Sonia has actually been my editor and like I know my sweetheart and my other right
Mhm.
hand. She is the one that actually launched my podcast 2 years ago. So
Yeah.
I'm so thankful to you, and it's such a cool thing to see you in this space on the other side.
Hmm.
Be so proud of yourself, and I'm sure you are, I'm sure your kids are, and your friends are.
Oh,
So, a
thank
humongous
you.
congratulations to you, and to do it in this space that, quite frankly, is so needed.
Mhm.
So,
Thank you.
I'm just thanking you and thank you for having me on.
Thank you. It's my honor. It is truly it's wonderful to be on this side. I didn't realize how much I would enjoy it. Um, and I love the part about helping women bring their voices to life. And that's what I love about podcasting. So it was an it has been an honor working with you and helping with you with your baby. So I appreciate it. Where can people find you? Can people work with you? Tell us about your services.
They can, if you want to reach me, you can still find me on themisfittherapist.com. You can find me on IG under the same handle. And as far as services or treatment, I'm actually not taking on new clients right now. I'm completely saturated. However, my organization, Aragon and Hernandez Social Services, is in Southern California. We are still seeing patients, and we do provide therapy on a sliding scale to those who are, lower income or just need a break, because therapy is expensive. So please feel
Mhm.
free to find us on the internet and reach out, and we will be happy to help you.
Awesome. Thank you. Thank you so much. And her podcast is The Misfit Therapist. And we have not published a new episode there in a while, but what is there is gold. So go listen to it. There's so many great nugget, some great pieces. I mean, you heard her personality. I mean, this is what it's like and better. So
Oh,
go
thank you so
listen to
much.
her. Yeah, I always, when I'd be editing, I'd be like, oh my gosh, so good, so good. And they're short and sweet, but to the point.
That's right.
So,
What we do here, damn it.
yeah. All right. Well, thank you so much. I will link everything in the show notes for the listeners.
Awesome. Thank you so
Awesome.
much.
I hope you enjoyed this conversation with Isette, or Dr. A, as her clients call her. Um, and that you found some really great nuggets of information. I'd love to hear what you thought about it. If you want to continue the conversation over on Instagram, on the post, and tell me what you thought, or if you want to, if you found this helpful, then screenshot the episode and share it with your friends, share it on stories and tag us so that more people um, can hear this conversation and learn these topics and learn about these things that, well, that frankly not enough people are talking about. So let's make this our best life yet. Let's make the next 20, 30, 40, who knows, maybe even 50 years of our lives the best yet. Let's love what we do. Let's love ourselves. Let's love what we look like. Let's love ourselves enough to get the help that we need, to advocate for ourselves, and to get us in the most optimal place, and fulfilled place. So thank you so much for being here. Hasta la próxima.